Welcome to Maestro Conference. Please enter the conference PIN number followed by the pound key. This call may be recorded. Thank you.
This is a mic check from the podium. 1, 2, 3.
And then during the response to your questions, you have a follow-up. You press 5 at that time. So 1 per question and 5 per follow-up.
This is the 2-minute warning. Reporters press 1 to ask a question.
Good afternoon. I'm Mandy Cohen. I'm the Secretary of the North Carolina Department of Health and Human Services. And today I'm joined by Director Mike Sprayberry. Karen Magoon and Lee Williamson are our American Sign Language interpreters, and Jackie and Jasmine Matevier are our Spanish translators. I'll start with a rundown of today's numbers. As of this morning, there were 186,887 laboratory confirmed cases. 916 people are currently hospitalized. And sadly, we added 51 new deaths today, a high for us, for a total of 3,111 deaths. A stark reminder that this virus continues to be dangerous and sometimes deadly. As we've discussed many times, testing is a core element of North Carolina's response to this pandemic. That means making sure cost and access challenges are never a barrier to a needed test. So, I'm pleased to announce that we are adding another new testing vendor partner to help us further expand free community testing. OptumServe will join the North Carolina Community Health Center Association and StarMed Urgent and Family Care to provide community testing events in several counties across the state. Between those 3 vendor partners, we have 230 free testing events planned across 80 counties during the rest of September and October, with more being added in response to our metrics. As with all state-supported testing events, there'll be no copays or costs for anyone seeking testing, including people who are uninsured. As we continue expanding free community testing options, we're helping North Carolinians to stay informed about their health and help slow the spread of COVID-19. Now, while it's too soon to know how the easing of restrictions to phase 2.5 and a Labor Day holiday weekend will impact our trends, we are currently seeing positive signs, particularly our metric that measures the percentage of tests that are positive. For the past few days, we've hovered around the 5% mark, and this is a very positive sign. North Carolinians are wearing masks and practicing social distancing, and it's helping our state stand out from the rest of the South. Last week's FEMA report showed us with the lowest percent positive in the whole region. Our steady, evidence-based approach is working, and I want to thank everyone who goes out of their way every day to take those steps to protect themselves, their families, and their communities. It's your individual actions that help protect us and help us make this progress so far. Beyond keeping up with the 3 W's, wait, wear, and wash, that means also getting yourself and your family a flu shot this fall. With COVID still around and spreading in our communities, it's more important than ever to get your flu vaccine. Flu shots are now available, and we know flu season starts right now in the fall. Keeping yourself and your family healthy this fall can help us avoid overwhelming our hospitals and to make sure everyone in North Carolina is able to get the care that they need this winter when they need it. I'm happy to see many North Carolinians are already acting on this. And based on the data we have so far, we're at higher levels of flu vaccines given this year compared to the same time last year. So that's great. Flu shots, as I said, are widely available. And to find out where you can get this year's flu shot, call your medical provider or your local pharmacy, or you can visit vaccinefinder.org. Later this week, I'll do our normal deeper dive into some of our data, but until then, keep up the great work practicing the 3 W's, wearing a face covering over your nose and mouth, waiting 6 feet apart, and washing your hands often. Wear, wait, and wash, and whatever your reason, get behind the mask. All right, with that, I will turn it over to Director Sprayberry.
Thank you, Madam Secretary. Good afternoon. Today is day 190 of the State Emergency Operations Center's COVID-19 response. The team continues to aggressively push PPE and, as Madam Secretary noted, testing as well. We're also closely tracking Hurricane Sally, which is expected to make landfall near the Mississippi-Alabama border and then move slowly across Alabama, Georgia, and South Carolina. It will bring heavy rains to the western parts of North Carolina beginning on Thursday and into Friday. Rainfall amounts up to several inches are possible in the mountains and central parts of the state. We should all be monitoring closely for possible flooding. Our state's water rescue teams will be ready to respond if needed. Hurricane Paulette is far out in the central Atlantic, but it's kicking up heavy surf and dangerous rip currents along our coast. Beach erosion and some overwash of North Carolina Highway 12 on the Outer Banks is expected at high tide. Vacationers at the coast should be especially aware of these hazards. The other named storms and unnamed tropical systems are currently not a threat to impact North Carolina, but we are at the peak of hurricane season 2020. We're all reminded to be prepared. Don't forget that the season runs for another 2.5 months through the end of November. We can't overstate, since we're trying to minimize contact with others due to the pandemic, please try to have a plan to stay with family, friends, or at a hotel if you have to evacuate during a hurricane. Having a plan costs nothing, and every household should have one. The state will have non-congregate and congregate sheltering available, but it's best to stay away from shelters where there will be others outside of your family. Also, make sure your emergency kit is ready and includes the necessary items to stay healthy during COVID, such as face mask and hand sanitizer. It's vitally important that we all do our part and follow evacuation orders when given and in the instructions of the local and state authorities. If you have questions about emergency planning, please visit readync.org for more information about plans, preparedness kits, and evacuations as part of our Know Your Zone initiative. Yesterday marked the 2-year anniversary of Hurricane Florence's landfall in North Carolina. Recovery work is still ongoing with more than $3.5 billion in state and federal dollars invested to help survivors of Hurricanes Florence and Matthew from both the Division of Emergency Management and the North Carolina Office of Recovery and Resiliency. We know there's much more to do, and there are disaster survivors still in need. The team at the Department of Public Safety, to include both Emergency Management and the Office of Recovery and Resiliency, are committed to diligently supporting those communities and individuals in need as we seek to develop a more resilient North Carolina, even as we battle the spread of COVID-19. Yesterday, I had the privilege to visit the dedication of the Baptist on Mission Charity Rebuild Center. It is housed in a former Duplin County Middle School in Rose Hill. Over the last 2 years, volunteers have renovated the school, which can now house and feed up to 200 volunteers working on a variety of disaster recovery missions. This rebuild center now serves as a food pantry during the COVID-19 pandemic, a place for volunteers to get tools and supplies, and a place for survivors to get furnishings for their rebuilt homes. Volunteers are the backbone of hurricane recovery in our communities. Since 2019, there have been more than 1.9 million volunteer hours tracked by volunteers working on the Hurricane Florence recovery. We're so thankful for their work and for the many volunteers who continue working on hurricane recovery in North Carolina, even during the pandemic. We know the state emergency response team could not be successful in achieving the mission without the incredible contributions of our volunteer partners. In closing, as Madam Secretary just mentioned, don't forget to go get vaccinated against the flu. I've already got mine. I want to stay on our good side. Also, remember, whatever your reason, now's the time to get behind the mask. Wear, wait, and wash. This is how we slow the spread of the virus. It works. And as always, don't forget to look out for your family, friends, and neighbors. Call your loved ones daily. With kindness and cooperation, we'll all get through this together as one team, one mission, and one family. Thank you so much. And thank you, Madam Secretary, for your leadership.
Great. Well, thank you, Director Sprayberry, for getting your flu shot already and leading the way here for North Carolina. And we will now open to take your questions.
Our first question today is from Richard Craver at the Winston-Salem Journal.
Hello, Secretary Cohen. This is Richard Craver with the Winston-Salem Journal. You kind of answered the question to a degree, but I just wanted to get a sense for when do y'all expect to really start seeing signs, positive and negative, from the Labor Day, from the Trump rally here in Winston-Salem, and these events since Phase 2.5 started?
Well, thanks, Richard. You were a little muffled there, so I think you were asking about when we will see in our metrics what may have happened over Labor Day and with the new easing of restrictions. And so what we usually like to do is see between 14 and 21 days after we've made a change. And so we're about 10 days or so, maybe 12, into some of those changes. We know we're just a little bit over a week away from Labor Day. And what I would say is last week was a very positive week. We saw our case counts be on the lower side. I was sharing that our percent of tests that are positive is really hovering at around 5, which is good. I wanted to get it even lower, but we know that that was a milestone we were aiming for. So very positive. But I would say we still need to see how this week goes. And so I want to make sure to encourage everyone, continue what you're doing. We are making progress, and I'm really proud of the hard work North Carolina has done. We are truly a standout in the South, and I want to continue that. So that's why we're going to continue on our path of making sure we are wearing our masks and doing the social distancing, waiting 6 feet apart and washing our hands, because I think that has really been an asset for us in the state. So we're going to keep on that path, and we hope to continue to still be able to make progress of easing further restrictions, but we still have a bit longer to look at our metrics. I'll go into deeper details on our metrics on Thursday with the graphs and the charts, and we can talk more then. Thanks.
We have a follow-up from Richard Craver, Winston-Salem Journal.
Yes, Secretary. I hope you can hear me better this time. I was going to ask you also about the Trump rally. Obviously, there's been a rally in other states since the rally in Winston-Salem, obviously some indoors, some outdoors. Is there any kind of specific metric y'all will look to do to trace people who either came in to Winston-Salem, attended the event, or people who attended an event locally in terms of being able to determine whether there is any kind of super spreader or community spread?
Well, thanks, Richard. So we do know when groups of people get together and they're not wearing masks, those are higher risk events. That means that it is possible that someone could have been at that rally who didn't know they had COVID and could have spread it to others. What we are asking is for folks who want to attend political events, just do it safely, do it with social distancing, and do it with masks. And what I ask of our elected leaders is to work to protect the folks of North Carolina. I think we've done hard work to get our trends moving in the right direction. I want to continue to protect the people of North Carolina, so I'd ask for their leadership as well as they have further events to make sure that we're doing those events with masks and with social distancing. Thanks.
Next question is from Travis Fain at WRAL-TV.
Yeah, hi. Thank you, Madam Secretary. My question is about ventilation projects and whether you've heard any kind of innovative ideas to deal with improved ventilation, particularly I'm thinking in schools with an eye toward getting younger children for whom online learning may not be working very well back into schools. Or is this an area that you know of any really interesting projects in North Carolina where people are trying new things with ventilation?
Well, thanks, Travis, for that question. We do know that airflow is important and is an important component of transmitting this virus, which is why we've always recommended outdoor activities over indoor activities. And I do want to say that we very much want schools and our kids to be back in person. They already can be back in person in our schools, following some maximum safety protocols, and we'd encourage folks to make sure that school districts are moving in that direction to get our kids back in person. As far as indoor ventilation projects, I have certainly heard of a number where folks are thinking about better air circulation and other kinds of projects. I think that is a good layer of safety protocol. It can't be the only safety protocol. I think even with good ventilation, we still need to do the tried and true things around social distancing and wearing of face coverings, particularly when you are inside. So I think that there are really good things happening in ventilation, but I don't want that to happen at the exclusion of some of the other evidence-driven safety protocols that we are putting in place specifically related to schools as they think about coming back in person. Thanks.
We have a follow-up from Travis Fain.
Yes, thank you. I just wondered, when do you expect kind of the next push or announcement from the administration on schools, whether it be to encourage this or that from various systems, or even to change the ABC plan a little bit? How far out are we from having seen what's going on the last month or so and changing the plan if we're going to change the plan?
Well, thanks, Travis. You're breaking up a little bit. I think it was when are we thinking about and how are we looking at our trends and what our recommendations related to school. Just to remind everyone that as a baseline, our entire state has been asked to operate at least at a Plan B option. And what Plan B means is that you can go in person, the buildings can be open, but with maximum safety protocols, including social distancing within classrooms, masks for everyone, screening for kids, etc. There are a lot of school districts that have opted for a full virtual or a Plan C to move beyond the baseline of what the state is requiring. And I know that many of those places that have moved to a Plan C have continued to look at Plan B options to implement those protocols and bring kids back. I will say our trends are moving in the right direction, and that is a very good sign. I think we continue to need to do ongoing work to keep those trends moving in the same direction. All of this progress continues to be fragile. So I want to encourage everyone to continue to do the social distancing, continue to do the masks, because we do want our kids back in the classroom. We're going to continue to work with our education partners to see if there are additional changes to our guidance that we can make as we move through this fall. Thanks.
Our next question is from Rose Hoban at North Carolina Health News.
Hi, Secretary Cohen. It's Rose Hoban. So I've got a couple of questions for you. You've talked a lot about the Latino community, and Governor Cooper had promised an executive order to protect them, but that's failed. How do you account for that? And can you also talk about the decision to declare agricultural workers, like Christmas tree workers, as essential?
Well, I think you are right, Rose, in saying that COVID-19 has disproportionately impacted our Latinx Hispanic community. And we've talked a lot at many of these briefings about our work to make sure that our response effort recognizes that disproportionate impact. So we've done a lot of things to make sure that we are reaching out, whether it is doing all of our ad campaigns around those important prevention activities in both English and Spanish. We are making sure to surge our testing infrastructure to the communities we know are hardest hit. We have surged nearly half of our workforce in contact tracing to make sure that they are bilingual, understanding that those are going to be folks who need to be from the communities that they're serving. And we've worked with our agriculture partners to make sure testing is available and work specifically with the farm worker community to make sure that we are shipping millions of masks to our agricultural centers around the state, our farms around the state, to make sure they had the prevention tools at the ready to make sure that we were slowing the spread of COVID-19. And what we've seen in the data is actually a bit of improvement in the data in terms of impact on the Latinx Hispanic community. We need to make a lot more, but I'm pleased that we're at least seeing some progress there. What I'd also say in our Latinx Hispanic community, we've been working very closely with the faith community as well, and I want to thank many of the Catholic churches and others who have been incredible partners in sharing the messages around prevention. So we're going to continue to work really closely with our Latinx and Hispanic partners across the board. I think you saw our partnership with the consulates of Mexico and Guatemala. Those are the kinds of partnerships that are incredibly important for us to continue to make progress. We know that making sure that we have trusted members of their community working very closely with us has been critical, and will continue to do that. Thanks.
We have our next question.
We have a follow-up from Rose Hoban.
I was going to ask you for some detail about how you're reaching out to these folks, but you've already given it to me. The one last question I have along those lines is, what's the role of migrant health centers, and how are you, what are you doing to help them address these issues in the community?
Sorry, Rose, you broke up there. Which facilities? Sorry.
Facilities, sorry.
The migrant health centers.
The migrant health centers.
So, Rose, as you may know, within the Department of Health and Human Services, we do have a group that is entirely dedicated to farm worker health. It is in our Office of Rural Health. It was operating before COVID, and it has been strengthened since. And I know that they work very closely with those farm health worker initiatives around our state. It's really hard work, and they are really working not only to get them the protective masks, but to make sure that we can either bring testing as close as we possibly can, even on site in certain circumstances for folks. So we continue to make sure that folks can have access to testing, but also their full range of health access that they need. It's an ongoing challenge, and I think many will know, because we haven't expanded Medicaid here, we do have a very high rate of uninsured in North Carolina, and that puts a strain on all of our system in terms of us being able to access care. But we work with the resources that we have. We have a very dedicated team, and we work closely with those communities. Thanks.
Our next question is from Brian Anderson at the Associated Press.
Hi, Dr. Cohen. Brian Anderson here with the AP. Thanks for the opportunity to ask some questions. And 14 days since we've heard from the governor, so we hope he too will make himself accessible very soon. We tried getting a straight answer from your department and the governor's office on this. I'd like to just try here again. President Trump hosted an event last week in Winston-Salem that had at least 7,000 people who were almost entirely maskless and tightly packed with no social distancing. The president will soon hold another rally in Fayetteville, and at a time when bars hosting only a few dozen people are barred from reopening, will your office or any local health department intervene to take any enforcement action whatsoever to address this imminent threat to public health as thousands gather? And if not, is science or politics driving this administration's enforcement process?
Well, thanks, Brian, for the question. And I think I was very clear at my last briefing that while there may be an exemption for First Amendment rights and political rallies, this isn't about mandates. This is about leadership. And I want to see more leadership from all of our elected officials in making sure that we are protecting North Carolinians. We know what works. Masks work. Social distancing works. So when I see gatherings close together with no mask, that's not respecting the hard work that North Carolinians have been doing over the last number of months. That's not protecting North Carolina. So while they may have an exemption from the executive orders and mandates, it's not about mandates. It's about leadership. And it's about respecting North Carolina and protecting North Carolina. So I hope everyone will be wearing masks and be social distance, but still participate in any political activities. Thanks.
We have a follow-up from Brian Anderson.
In the absence of that federal leadership from President Trump, what do you do at a state level?
Sorry, can you repeat that, Brian?
In the absence of that leadership from the federal administration and the Trump campaign, what do you do from a state level to remedy that issue and ensure North Carolinians can be kept safe?
I'm going to use this microphone right here to remind everyone to make sure to do the 3 W's. I think we've been talking about it a lot. We know what works. We know we want to protect each other. I know that folks care deeply about protecting their families, protecting their communities, and I hope that they will use their good judgment to continue to do that. And I want folks to participate in the political process. I think it's very important, but you can do that safely. Do it at distance. Do it with masks, and so that we can be protecting each other as we go forward. Thanks.
Our final question today is from Ben Sessoms with the News and Observer.
Good afternoon, Secretary Cohen. Thank you for taking my question today. So positive COVID-19 tests have hovered around 5% over the past week. Is this an indication that viral spread is being controlled, or does the state need to do more in finding people who are infected, including those that are asymptomatic?
Ben, that's a great question. And I think it is why we don't look at any one metric exclusively. I think we're happy to see that our percent of tests that are positive has been trending down, meaning that we think we're doing a fair amount of testing and not as many are coming back positive. And that's a good thing. But I think you're exactly right to say we need to make sure that we are targeting our testing efforts in populations that are at higher risk of being positive. We know that tends to be our historically marginalized communities. It's again why today we're announcing yet another partner to surge additional testing into communities we know that have less testing access and may be at more risk from COVID-19. So I think that is why we, one, look at multiple metrics. We need to look at case rates. We need to look at hospitalizations. We look at our surveillance. But we also need to watch these trends over a period of time. So while the last number of days have been very good on that trend, we want to make sure that we see that going forward. So I think more to learn and more to see in our numbers as we go forward. Again, I'll be here with the governor on Thursday doing a deeper dive on our data at that point. And again, we can speak further about where our trends are and where the progress we need to keep making. Thanks. All right.
We have a follow-up from Ben.
Great. Thanks, Ben.
Just one more question, Secretary Cohen. So Democratic U.S. Senate candidate Cal Cunningham said during the debate yesterday that he would be hesitant to take a coronavirus vaccine if it were developed by the end of the year due to questions surrounding what he called political and financial corruption in Washington. Do you have similar concerns, or should North Carolinians take a COVID vaccine even if it is available in just a few months?
Ben, thanks for asking that question. You know, as I have watched the federal government do hard work around vaccines, I've been very impressed with the work that the scientists have been doing, the fact that the federal government has taken on some of the financial risks of trying to get a vaccine out quickly. I think that is all very positive. I do think there is a lot more science left to do and research left to do and see. But I have heard personally from the career regulators at the FDA, heard about the process that they're using, understood the safety and efficacy metrics that they're going to be using. I feel very comfortable right now as I hear about that process. Like I said, there is still a lot more science to do, but we know that vaccines are going to be such an important tool to us combating this crisis. So I am pleased that the federal government has worked as hard as they can to move as fast as they can. I see the safety work that are being done in all these trials as being very good. As you may know, one of those trials was put on pause because of a safety concern, which is absolutely right, and I think indicates the process working as intended to make sure if there are safety concerns, things get paused and you dive deeper into the data. So I think we all need to watch for the data, let the regulators do their job at the FDA, and be ready to take the vaccine when it is safe, when it is available for everyone to have it. So I look forward to that day. I plan to get my flu shot because vaccines work. And so I look forward to our scientists continuing to run forward to get us a vaccine as soon as possible. Thanks. All right, with that was a lot of really good questions. I really appreciate the opportunity to talk about our testing, the progress we're making in our metrics, but the work we have left to do. And thank you all for doing your 3 Ws, and no matter your reason, get behind the mask. Thank you so much.